So step 2 is planning. You need to plan. If you don't plan, how do you know whether you're going to succeed? How do you know if you're succeeding? How can you judge where you want to be? And you can't evaluate. If you and your team do not know where you want to be, how do they know whether you've succeeded? How do you know? So part of this, and I'm afraid this is probably the least favorite slide, and you probably don't want to go here, but your numbers are critical. So when we work with a practice, we start with the numbers. People think marketing is really exciting, it's all the bright, shiny things, but actually it's all about your numbers, it's all about your tracking. You need to know your growth goals. You need to know where you want to be in your practice. You need to have a budget, because how are you going to meet those goals if you don't have a budget? You need to know how much a patient is worth to you. And you need to measure your marketing and see what the return on investment is. So who here has growth goals? A few. That's great. So you need to know whether you are in rapid growth mode, which is pretty much a practice that's new, a practice that's lost a lot of patients, and you have to accelerate this. And with this, you need to have a high marketing budget, 7 to 10% of your revenue, of your production. Sustained is pretty much where most practices are, where you need new patients and you need to retain existing patients. And there you're talking about maybe 4 to 6%. Then who here is in retention mode? Who here doesn't need any new patients? They just need to keep the patients that they've got in the practice. It's pretty rare for us to talk to guys that have got this, but that's 2% of your revenue. So if you don't know how much a patient is worth to you and your practice, how are you ever going to know how much you should spend to keep them in your practice or to attract them to your practice? If you don't know these numbers, how can you judge? So one of the common mistakes with thinking about how much they're worth is thinking maybe for a year. You need to think about the lifetime value of a patient. You need to think how long, on average, you are keeping a patient in your practice. And this is something that you and your team need to be looking at. You need to think how much, obviously, they spend per year and for the lifetime. But you also need to think about referrals. We all know that the number one way for you to get patients into your practice is word of mouth. Yep. So you need to think about how many referrals, on average, one of these patients is bringing in. And then how much they spend. And that is then you get to true reflection of how much they're worth. Return on investment is judging and tracking how much you are spending on every piece of marketing. And this includes your staff time. And tracking it against the return. So we say, so when we're working with a practice, we will judge something as successful as if you are getting a 3-to-1 return on investment. If you're getting less than that, you need to look at that, you need to drill down, you need to work out what's going on, tweak it or stop it. So you need to know your numbers, and you need to constantly track these numbers. You need to review what's working and what isn't working. This has to be part of your ongoing process, because if you don't know, you will never succeed.